Hi there, and welcome to the information webinar for Research Connections COVID-19 Rapid Response. I'm Danny Robertson-Boersma, the Funding Programs Officer at Saskatchewan Health Research Foundation, and I'm also the Program Manager when it comes to this application. So just to give you an idea of what this information webinar is about, first I'm going to do a quick grant overview, specifically focusing on the purpose and objectives of this rapid response. Then I'll go into the grant information and important dates, applicant eligibility, the activity application, activity budget, review and criteria, and then finally the contact information. So regarding this grant, this does come from our research connections that we've been hosting for many years now, but what we're trying to do here is have a very specific rapid response to the current pandemic that's going on, and we want to focus on finding KMB initiatives that relate to COVID-19 and to the province. So there will be some differences in comparison to what you've seen previously when it comes to research connections, so please be aware of those differences. Also be aware that everything should look pretty good when you do get onto our research management system, otherwise known as the RMS. But because of this being a rapid response and us also having to respond quickly, there might be some little weird things, but we'll be creating a instructions video for you on that as well to help you and guide you through this application process. So regarding this rapid response, as I noted, this is focusing on the knowledge mobilization initiatives. So these proposed activities must facilitate the collaboration, sharing, use, and integration of existing health research knowledge that's specific to COVID-19 response in Saskatchewan. And what you're trying to do is get this information out to the appropriate knowledge users within a feasible and time-sensitive manner. So you'll be able to request up to $10,000 of matching from SHRF. And I'll get more into it a little bit later, but again, this will be a bit different than what you've seen in our open research connections competitions, so just keep that in mind, but you can request up to $10,000. And as I said before, the focus is to share, use, and integrate health research knowledge, and we're trying to do this in a quick and responsive way. So the purpose of this grant application is to support short-term targeted human health research knowledge mobilization, so that's at KMB, initiatives taking place in and having a practical application for Saskatchewan knowledge users. When it comes to knowledge users for this grant, we're talking about health professionals, patients and families, the community members and public, policymakers, government, researchers, and students. That doesn't mean that there may be others as well. You just would have to justify and describe them in your application. So within the purpose, there's also two specific objectives. The first is to support the innovative, far-reaching, and impactful KMB activities that are specific to a rapid response to COVID-19, including the health and wellness implications these necessary responses have on the public. The other objective for this grant is to facilitate the sharing, use, and integration of existing health research knowledge in a way that rapidly responds to the situation faced by Saskatchewan communities, leading to one or more of the following. So it could be informed decision-making, a more knowledgeable and prepared public, increased knowledge, or resources for frontline or essential services. So what that means is what we're trying to do here is be able to give good, strong information to people within the province when it comes to maybe specifically what's going on for policies, and being aware that this, because we are a health research funding foundation, but we do have this idea that this grant will support individuals when it comes to understanding what's going on with policy, what are maybe if there's some economic information that they need to know, and things like that. So it's not specific to the virus itself, but also just to what's going on socially and how we can continue to support the people in the province to stay as healthy as possible during these times. So just getting into the grant information, I do want to put out there, having talked about the purpose and objectives, so this is not a grant to support knowledge creation or data collection. The knowledge must be existing or generated through research activities that have been supported by other means. So if you had maybe done previous research related to mental health that could actually be supportive for what's going on right now in our province, that research, you can take that and then apply for further funding to get something out. And I'll discuss more about what those kind of activities could be. So regarding the funding, you can request up to $10,000 per proposal, and there's no minimum request. So maybe if you know you only need $1,000, you can request that. There's, like I said, no minimum, but the maximum is $10,000. Then what does happen, this is still a matching grant. So additional support from other sources are equal to 50% of the requested SHRF required. They can be both cash and in-kind contributions. So in previous research connections, we've said that it has to be at least a certain amount for cash. But again, this is a rapid response. So if you're able to find 50% of in-kind contributions, that will be allowable, but you still need to hit that 50% mark. So an example would be, if you're asking SHRF for 10,000, you need to get at least 5,000 in other sources. If you do have any questions about that, you can always contact me and I'll have that information at the end. So the duration of this grant is 6 months from the start date. So please make sure that when you are writing something, it has to be feasible and it has to be able to be done in 6 months. Again, this is a call for a rapid response, so we need things to go out quickly, but done well and has to be feasible. So regarding timelines, this will be launched on April 1st, and then it's going to be a rolling intake. So at this time, we don't have a deadline. Either for applications or for the grant itself. We will keep it up and going. As everyone knows, no one has any idea of how long we will be in this, so we wanted to make sure that we can stay flexible and our grants reflect that as well. When we do have an end date, we'll make sure that people have enough time. We'll make sure, that everyone has enough time and that they're aware of what this end date is, so that if you do have an application that needs to be submitted, you'll have ample time to complete that. So from the time that you submit your application, we're hoping to get the funding decision out back to you within 5 to 8 business days. So say you submitted something on April 15th, within those 5 business days, but up to 8, we'll have internally reviewed the application, and then we'll be able to send you information regarding if maybe we need to have a little bit more information from you, or if everything's good to go, then we can send you a funding letter, and that will have the start date, so when the funds will be sent out and you'll be able to access them. So as you can see, with this being a rapid response, we're going a bit different with our timelines and everything. So if you have any questions, again, please don't hesitate to contact me. Going forward, just to discuss the applicant eligibility. So the principal applicant must be employed by an organization in Saskatchewan with an interest in health research, and the KMB that is eligible to administer the grant funding. So funds must be administered by an organization that is CRA qualified donee in Saskatchewan, and that will provide a statement of account to SHRF. So this could be a post-secondary institution, it could be a health agency or something similar. This is a bit different than our usual grants, but it's the same when it was for our research connections, is that this is open to others to apply, other than those that may have a position with one of our Memorandum of Understanding institutions. So that's the principal applicant, so it's pretty open. When you are the principal applicant, do remember that you're our touch point when it comes to you and the team and with SHRF, and you're responsible for making sure the application is complete and that you submit it. And there's other definitions around the principal applicant as well that I'd be happy to share. So when it comes to other applicants, otherwise known as our co-applicants or co-principal applicants, we do strongly encourage that the principal applicant apply with other applicants who have the expertise to strengthen the proposed activity. Applicants added to the application should have an identified role and bring value to the proposed application. So other applicants can be from within or outside the province or country, but the application must demonstrate that the majority of the work will be done in province. For this funding opportunity, when you do go into the RMS, individuals may be invited as a co-principal applicant, co-applicant, or a grant facilitator. And finally, just making sure as the principal applicant that, as I said before, the organization you're with does need to provide a statement of account to SHRF. So that's why we said usually they have to have a health research interest. They have to be able to administer the grant funding for us when we send it over. So that's why we need them to be a CRA qualified donee. So going into the activity application, so the principal applicant, this is something different than our Research Connections open grant. So for this rapid call, the principal applicant may only hold one active grant at a time. So, but you may be a co-applicant on other grants. So what this means is that the principal applicant may not submit a new application for this funding opportunity until previous grants from this particular call are completed and all required reporting received by SHRF. So that would mean is you could apply for one grant, and then if you're successful, you'll go forward, do the work that you identified you would do, and then you would just need to create, you would need to submit a final progress report and a financial statement. Once that's all reviewed by SHRF, then we'll say you're good to go and you're able to apply for another one. So when it comes to the actual application and what you need to know, so the rapid response activity, it should foster the dissemination and exchange of health research knowledge related to COVID-19 and the related response. We did identify out of province participation may be encouraged, but the intended audiences must include Saskatchewan, and the work must primarily be completed in Saskatchewan as we are a provincial funding agency. Make sure to include a detailed work plan and timeline showing how the activity will be shared with knowledge users and evaluated for its effectiveness. You can involve individuals with appropriate expertise, including but not limited to patients and families, government, health professionals, policymakers, health charities, community members and public, researchers and students as appropriate. Make sure that you identify who the knowledge users are and the possible benefits they will receive. For this grant, the knowledge users may be part of the application side of it, so they can be invited as an applicant and they will have input into the application and how the work will go if funded. Or they can be identified as an audience member, or they could be both. So the application must be based on legitimate and vetted research, although it may or may not be directly related to the funded research project. You need to produce timely and concrete deliverables, so keep in mind that 6 months is how long you have from the start of the grant to completing what you say you would like to complete. You will need to include a budget where all line items are evident and justified in the application, and you must contain an evaluation component to measure the desired outcomes of the activity. This is a rapid response, but we do want to make sure that when, as always, when we send out the money, is this something that we can then evaluate afterwards and see, did the outcomes of the activity work out or not? So those are the high level information when it comes to the activity application, and you are able to find that information on page 3 of the program guide. So a couple of examples when it comes to something that you could be doing. This could be quite simple. It could be, and I'll just use it as an example, say you're creating a pamphlet for individuals, for community members, where English may not be their spoken language, and so we want to get this information out in different languages. So you might need someone that can translate the information for you. That would be eligible, and then we want to make sure that it's getting out in the appropriate way to the knowledge users, whether that maybe be through mail, is it on a website, anything like that. So we can, you can apply for funds for that kind of information. You may need to hire someone to coordinate this work and everything like that. So as long as it's justified and it's related to the activity, we can look at making sure that some people are hired on to make sure this research gets done. As I said, it could be a website. Maybe it's something like creating a video. Obviously, please pay attention and please be aware of what the public health officials are putting out when it comes to gatherings and who can see who and everything like that. So if you can do this in a virtual way, that is best. But if you're trying to create a video to discuss something about mental health and how you can take care of yourself, or maybe it's something about how to keep kids active when you're inside and you are working on social distancing. So we really want to be open to what could come in, but we just want to make sure that you are focused that this is for COVID-19 and that it's a rapid response. So moving on to the activity budget. So as I said before, this is a matching contributions grant. And so you do need to have that 50% matching contributions, but what is different from our usual research connections is that it could be all in kind, it could still be all cash, or it can be a combination. Also, please note what's different for this one is that you are able to access your operating grants or other funds, maybe some startup funding you have, things like that. We are loosening the requirements when it comes to that in comparison to the research connection. So if you have any questions regarding what is eligible and what isn't, please contact me. But what we're trying to do is get that work out in a responsible way. So just keep in mind that it does need to be 50%. So as I used the example before, if you request 10,000, you do still need 5,000 in matching contributions. So when it comes to the review and criteria, this is an internal SHRF committee that will meet, and that's why we can meet quickly. There's 3 high-level things, just like in our Research Connections Open Grants. It's what are you doing, how are you doing it, and how will you know it worked. So when it comes to what are you doing, a couple points are, do you identify and clearly explain the need or rationale for the activity? What are the goals of the activity? And are they clearly described and feasible? So in relation to Saskatchewan's COVID-19 response and its impact on the province, does the proposed activity facilitate the sharing, use, and integration of existing health research knowledge in a way that rapidly responds to the situation faced by Saskatchewan communities? So that all encompasses the what. When it comes to the how you're doing it, keep in mind some of the questions we will be looking at is what are the actions being implemented for the activity? Are they appropriate, meaningful, and measurable? Are they supported by budget timelines and everything else in between? And is the activity based on legitimate and vetted research? Are knowledge users clearly identified and described? And what are their roles when they are identified? And is there evidence of other planned resources such as time, human, financial, things like that, including matching funds, the in-kind supports, and maybe any collaborations you'll be able to do within this? And does the activity proposed have the potential to lead to one or more of the following: the informed decision-making, a more knowledgeable and prepared public, and increased knowledge or resources for frontline or essential services? And then finally getting into that third criteria, the how will you know it worked? Are the intended outcomes and impacts of the KMB initiative clearly described? Are the proposed outcomes and impacts measurable? And are methods for measuring clearly described? So that might be you're doing a survey, maybe you're doing on phone interviews, anything like that, just to check up and be able to measure the outcomes of your proposed activity. So that's it for this information webinar. It's a very quick one, as goes with the theme of the rapid response. Like I said throughout, at any time, if you have any questions about eligibility, program guidelines, or the review process, you can contact me, Danny, at drobertson-boersma@shrf.ca. You can also call me, just leave a voicemail just in case I don't answer. So that's at 306-975-1685. And for other questions or for technical help with the SHRF RMS, you can contact Tanya. She's our programs coordinator here at SHRF. She can be accessed by email and I believe by phone as well, but it's probably best just to go email first, and then she may set up a Zoom call with you if necessary. Also keep an eye out for a quick video on the RMS and the application within online And yeah, that's everything here. I hope you're all taking care of yourselves, social distancing, really physical distancing, but I hope you're still socially contacting people and taking care of yourselves and washing your hands. And from me and everyone at SHRF, take care.